Hi, my name is Pauline Isabel Isenteno, and today I will demonstrating pharmacology concept, which is the administering oral medication. The definition of this is it delivers medication for absorption through alimentary tract. The oral route is the safe and the most convenient and relatively economical way in administering solid or liquid form of drug preparation by mouth. Many oral medicines are given in solid dose form such as tablet and capsules, which have high degree of stability and accurate dosage. The goal here is the medication successfully administered via oral route. The patient experiences the desired effect from medication. The patient does not aspirate. The patient experiences decreased anxiety. The patient does not experience adverse effects, and the patient complies with the medication regime. The materials needed is a prescribed medication, medication card, medicine cup, calibrated towel, medicine dropper, sterile gloves, optional. For assessment, we need to verify physician's order of medication, check for medication listed on medicine card against the physician order sheet and standing order sheet. First check for the right patient, right drug, right route, right dosage, and right time of administration. This is to determine if the physician order are proper to the client, and if not, have a personal connection to the healthcare provider or pharmacist to prevent medication error. Next is check the client chart for allergies. So, check whether the patient has previous drug reaction. If we have concerns, discuss it with the prescriber before administering the medicine. Next is know the actions, special nursing consideration, safe dose ranges, purpose of administration, and adverse effects of medication to be administered. This is to consider the appropriateness of the medication for our patient. For planning, we need to wash our hands. Hand washing with soap remove the germs from hands, and this prevent infections. Next one is prepare medication for one client at a time. This is to avoid serious medication mistakes or error. Third is to ensure proper lighting to facilitate ease in administration. For implementation, select the proper medication from the drawer or stock and compare it to the Cardex. So we need to check the Cardex because it gives us a brief overview of each patient and it is updated every shift. So check the expiration dates. We can determine the expiration date on the packaging of the drug. And after that, we can perform calculation. For unit dose package medication, place the capsule or tablet directly in a disposable cup. So do not open the package until at bedside. So we don't open the package until bedside to prevent confusion in administering medication, because some medication are look alike and have the same size or shape. So this is the most efficient and safe among patients because it has predetermined amount of drug. For example, it has 500 milligrams. We can cut the foil or repack the medication with the designated drug name. So after that, we will put it on our tray. So after that, for medication in stock container, pour the necessary number into the bottle cup. We will open the lid and pour amount of necessary drug. This is to return the excess tablet or capsule back again in stock container without contaminating the other medication. And after getting the desired amount, we will now place it in a medication cup. This is after we get the right amount of drug. And then after that, we will close the lid of the stock container. After that, for liquid medication, we will now remove the cup and place it upside down. Hold the bottle against the palm and then place medication cup in a flat surface at an eye level. This is to minimize the error. After that, pour the desired amount of liquid and read the amount of medication at bottom of the meniscus. So here is a 5 ml. Remember, do not touch the medication, but pour the medication directly into the bottle lid or the cup. Return any extra medication to the container. After that, we will now close properly the medicine and return it on the side. So next is recheck each medication. For one client has been prepared. So using our medication card, check once again the medication order before taking them to the client. We can compare the information on the medication card. This is to check for second accuracy. So after that, we need to close the box of the drug if we have, or place the lid of container we use, and check the information on it. For the third time, read the medication card or MAR. So, medication that requires special storage must be replaced immediately. Put the medication container back in the shelf. And place the cup containing the medication next to the medication card on the tray. So we will now place all the medication. Okay. So after that, we will now transport medication to the client bedside carefully. Walk carefully so that medication will not spill. And keep the medication inside at all times. This is to keep it away and out of sight of the young children, and if the client may take the medication in wrong route or time. So next is to see the client receives at a correct time. So it is. Next is to identify the client carefully. There are 3 ways to do this. Check the name of the client identification bond. Ask the client his or her name. What is your name, ma'am? Okay, ma'am. Thank you. Verify the client identification with staff members who knows the client. Ask the colleagues or previous staff nurse who handled the patient. Assist the client in an upright or lateral position. Place the client in Fowler's position. If the client cannot remain in Fowler's position, place the patient on the right side with the head elevated. So, we can put some pillow at the back of the client for support. Administer medication in 3 ways. But before that, we need to explain the medicine medicine is being given, and answer any patient question. Keep any special instruction or teach the patient about the medication. For example, good day, ma'am. Today I will administer vitamin C or ascorbic acid. This will be needed for repair of tissues and in all parts of your body, and to prevent and treat scurvy. Next is offer water or other permitted fluids with pills, capsules, tablets, and some liquid medication. Give the patient a glass of water or juice and have the patient place the medication in the back of his mouth. So take a sip of water and swallow. So most medication dissolves better and causes less stomach discomfort when it is taken with adequate liquid. So next is ask the client preference regarding the medication to be taken by hand or in cup, it one at a time or all at once? Mom, do you want to take the medicine by cup or using your hand? And we can also ask, Mom, do you want to take the medicine once at a time or all at once? If the capsule or tablet falls on the floor, it must be discarded and a new one must be administered because this drug is now contaminated. Record any fluid intake or output measurement as ordered. So, for example, the patient only took 50 ml of water on his glass or bottle, so we will now take note of it in our nursing notes. Remain with the client until each medication is swallowed. Do not leave the medication at the bedside of the patient to take it later. The nurse cannot ensure the patient if she or he takes the medicine unless we see him or swallowed it. Assist the patient back in a comfortable position. So after that, we need to wash our hands. So for evaluation, evaluate using the following criteria. The 10 rights are followed, the right patient, right medication, right dosage, right route, right time, right documentation, right client education, right to refuse, right assessment, and right evaluation. The correct site use, effectiveness of medication assessed, any side effect promptly identified. For documentation, record pertinent data in terms of medication dosage, route of administration, right time of administration, and signature. Document the administration of the medication immediately after administration. The patient update any records of the MAR or note of the chart the time that the medication has given and sign the names or their initials. Record accurately the medication that was given as ordered. Also, record if the drug is refused or omitted by our patient and notify the charge nurse or the healthcare provider if the patient didn't take the drug for some reason. Later, check the patient again and note any responses for adverse effects that needed to be recorded on the medication card and report it to the physician. Thank you.